Algo Therapeutics was born 5 years ago in 2018, and we are focused on a single type of indication, which is peripheral neuropathic pain. So that is pain of neurological origin in the distal parts of the body, so mostly the hands and feet. And the company is focused on a program called ATX-01, which is extremely innovative in the sense that it treats that local pain in a local fashion. And in other words, acting locally on the nerve fibers where the pain is, in the hands and the feet. And the prime indication for our program is actually the pain of chemotherapy. It's called CIPN, chemotherapy-induced peripheral neuropathy. And unfortunately, it's highly prevalent. It's 2/3 of chemo patients will have neuropathy. And there is nothing to treat it, absolutely nothing. Some drugs, some systemic drugs have a bit of efficacy, but none is approved. So we're extremely hopeful that with a local treatment that will act in the skin of the patients on their feet and their hands, we can silence that pain without interfering with cancer treatment, which is a difficult task. So that's what we're all about.
All right, and what's the compound that you're using? What's its mode of action?
So we're actually using an antidepressant called amitriptyline, which goes back quite some way. And very surprisingly, when we started testing it topically, so applying it to the skin, we discovered that it then has a mode of action which is completely different from the mode of action in depression. That is, it actually inhibits the activity of the sodium channels inside the nerve that create the pain message. So by applying amitriptyline at high concentrations to the skin, you're essentially blocking the pain message from getting anywhere. So the beauty of it is it's independent of the chemotherapy that caused the pain. It's really blocking the pain signal.
And where are you at on the path to commercialization, I guess?
It's getting really exciting because we're now fairly advanced in our phase 2 program. So our biggest phase 2 study is a very large CIPN study, which we're running in the US and in 6 countries in Europe. It's about 40 centers, 240 patients. And it's a double-blind, placebo-controlled study. And we'll have 240 patients. We're halfway through recruitment, so it's, we're getting there. And we will have readout on that study by the end of next year, 24. We're also conducting a smaller study in another indication, which is really interesting. It's called erythromelalgia. It's a rare disease, and it presents with a form of pain that's pretty similar to that of CIPN, a burning pain that's it's a terrible form of pain. But by inhibiting the sodium channels in the nerve, we could be able to silence that pain as well. So we're now in phase 2 in erythromelalgia as well. And that's a small study, 14 patients. It's happening at the Mayo Clinic in the US and in Erlangen here in Germany. And we're missing one patient that will probably come in this week. So the efficacy data will read out in March. So that's only 4 months away. So we're really excited about that.
Absolutely. And what brings you to BioEurope?
Well, actually, to spread the news that efficacy data is coming. We've had a lot of interest from specialty care companies, supportive care companies, pain companies, theoretically from the beginning. They like the program, but now that we're getting close to efficacy data is when we really need to engage with potential partners, because as soon as we have that phase 2 data, we'll need to work together. So it's been mostly about meeting potential partners for the program, and as always, interacting with peers, with investment funds, it's always exciting.
And good meeting so far?
Oh yeah, excellent meeting. Very, a lot of the anticipated stuff and some of the unexpected stuff, which makes the salt of the day, in these meetings.